Hello? I hope you can hear me. Thank you. Thank you, Amy. Good morning, good afternoon, good evening, everyone. I am called Sarah Katkunda. Thank you, Amy, for introducing me, and I work with UPMB. I'll start by saying a few words about UPMB. Uganda Protestant Medical Bureau is a national faith-based not-for-profit organization which was established in 1957 as an umbrella organization for the Protestant and Pentecostal church-founded health facilities. UPMB is a network of 313 member health facilities, and out of the 313, 19 are hospitals. Out of the 19 hospitals, we have 16 health training institutions. Our vision is a preferred Christian health care partner for sustainable services. That's briefly about Uganda Protestant Medical Bureau.
And I got your slides up.
Yay! Oh. Okay. So I can transfer?
Yeah. Morning, are you there? Yes.
Congratulations. It's fine? Okay.
Okay. Hello? Hello? Hi. I hope I'm not too short for the people behind. Okay. So our topic today is managing a seamless transition from international local USAID implementing partners, from international partners to local partners. And we are going to share with you our experience. Allow me acknowledge the authors of the successful abstract whose names appear on that slide. So what do I mean by transitioning from international organizations? So on the 12th of August 2020, Uganda Protestant Medical Bureau signed a cooperative agreement to implement the USAID local service delivery for HIV and AIDS activity. At that time, there were four international NGOs who were implementing USAID RIGHTS activity. RIGHTS is regional health integration to enhance services. So they were in the 5 regions of Uganda. So what it meant for signing that cooperative agreement by UPMB, those international NGOs were supposed to hand over 161 health facilities that they were supporting to the LSDA. And that actually was supposed to happen within that period of 12th of August, so that by 1st October, they will be implementing, the implementation will start. So you see that it was a really, really very short time. I smuggled in that slide to show what we are currently doing. Those are the objectives, that is the goal. I will not take a lot of time on it. So currently we are still in the 5 USAID regions in Uganda, and we are within 57 districts in the whole country. We are currently supporting 187 health facilities, 34 are sub-grantees, and the rest are directly supported. We also have 3 consortium members and 25 civil society organizations. the map of Uganda, those are our sites which are in red on that map. So how did this happen? These are the methods that were used. Definitely, number one, we worked closely with USAID Mission Uganda for overall technical assistance to the transition and system improvement. They helped a lot. They did a great job. Thank you so much, USAID. We engaged the regional rights mechanisms, those former implementing partners, for critical information and data. So we got information from them on the status of those facilities that they were supporting, and they did a great job in providing that information. We also engaged private not-for-profit mother structures to aid the facility entry. We closely collaborated with Ministry of Health and local government for policy guidance, supervision, training, and logistical support. Decisions were decentralized to health facilities with clear guidance from LSDA, and this built confidence and ownership of the project among PNFPs. Then we issued letters of authorization to spend for timely flow of funds as other preparations were ongoing. So we also improved the systems, internal systems, by establishing the regional offices. So those were the results. 123,256 clients were transitioned to LSDA. Out of the 161, we sub-granted 34. I think I've already explained that. We shall run through. And 80% of the annual targets were met at the end of the year. So we also, this was made possible because of the strong sub-recipient monitoring measures and capacity building. So recommendations, peers. Oh. The time is up, so that's why I skipped that slide. Okay, let me wind up.
That's the first question we're going to ask her.
Okay, let me wind up. We recommend that there should be meaningful collaboration because we are peer-to-peer, local to local. So they send us hot emails and we sit at a round table and discuss things and explain. We also propose that SOPs for seamless transition be documented and disseminated so that at least other partners who are transitioning can use them. Capacity building for local partners in managing US government. Of course, ASAP is already doing a great job on that, but we request that ASAP maybe get some individuals in in local organizations who are IPs to train the sub-recipients. So it's like training of trainers. And most awards should be given to local organizations so that health systems are strengthened.
Thank you so much, Sarah. Thank you so much, Sarah. We purposely designed this so we just have 5 or 6 minutes. We're going to come back, and the first question she will have is around challenges. So I'd like to welcome, thank you so much, Sarah. If you could hold your questions until the end, we'll have a robust discussion. If I could invite Dr. Eklilu Gebremikhev to the podium for the next presentation from Love in Action, Ethiopia.
1 minute more. Thank you very much. My name is Aklilu. I'm from Ethiopia and working for Love in Action Ethiopia. Aklilu means a crown. I'm the firstborn in my family. Congratulate me, please. Five.
You have to hit
This
this.
day?
Yeah.
Yeah.
There you go.
No, it's not working. It's not. Keep going.
Next one. Yes, there we go.
So my organization is Lab in Action Ethiopia, and the title of the abstract is Promoting High HIV or Project Performance Management Culture. Shortly, we say HPPC. Actually, the HPPC approach in LEA is very simple. The definition is very simple. We just view it as rethinking or reorganizing the existing project management or program management systems and approach tools that we have in the way we can ensure high performances. It can be in the form of strengthening our staffs, promoting relationships, strengthening relationships, and clarifying expectations of the organizations and the donors, and looking at on the planning system of the project as well as the organization. It's as simple as that, but it is high impact process in the organization. I did wrong, didn't I? They have been working in 497 waradas of 8 regions in the country. I don't know, something wrong.
All right, you guys.
Some technical errors over there. Let me use my laptop. Yeah.
Looks like it's loading up
Yeah.
again, but
Yeah.
just keep going.
Yeah. Yeah. I need the pictures.
Oh.
Sorry, we were working on 497 waradas of 8 regional states. These are the districts that we have been working. The red one is a region where we have been implementing the USAID funded project. The activity title of this project is HIV Epidemic Control Grant for Local OVC Services in Gambela region, which is targeting OVCs, adolescents from 9 to 14, and then pale HIVs. The key priority areas are HIV testing service, care and treatment, and OVC mitigation. We are just addressing both the prevention aspect and the care and support aspect. This is Gambela region. These are some of the problems or the key challenges in Gambela region. I know Gambela has a good face. On the other side, this is the problem face of the region. Flooding is a problem. Infrastructure is a serious problem. Triple burden of TB, HIV, and HTP, including child marriage of 47%. And capacity of health facilities. All these things are the problems in Gambela region. On the top of this, Gambela is one of the hardest to reach region in Ethiopia with highest HIV prevalence in the country. That is 4.8 or from 2 up to 30. So I want to talk about the creation of the HPPC idea. When we were assigned to work in such problematic region, one of the questions which came to our mind was, how does Love in Action Ethiopia uphold its existing high performance to USAID new assignment as a prime in such problematic, in such difficult context or situations? That was the things that we have been dealing with the management. In the middle of our discussion, or as we have been looking for strategies, HPPC approach was born and designed and presented to the management as one of the key strategy to uphold or to sustain our existing high performances. The key implementation approach of the HPPC approach are 6. I don't want to go into details on each of them. I think we will have other time just to talk about the details. The first approach was just we are working on casting and mainstreaming and promoting the idea itself among our staffs and our other representatives, especially on the importance of high performances, and the approach itself was one of the implementation approach which we have been using. The second one is the program managers of each of the projects are assigned as HPPC follow-up team. That is the second approach. The third one is we regularly conduct GSS or GISS, Joint Integrated Supportive Supervisions. When we started the program, it was GSS. After the TA partner or the International Technical Assistant Person joined, the name changed to GISS. And we organize the key stakeholders in one command structure based on their relevant responsibilities without having kind of overlaps and overuses. The fifth one is we try to incorporate some simple micro-planning processes. Finally, we have a follow-up system, which we call it real-time feedback management. There are other approaches as well. These are some of the results which we get as a result of or as a result of implementation of this approach. In FY21, out of the 23 key indicators, 74% of them are above 100%. In FY22, out of the 21 key stakeholders, 18% of them are above 100%, 14 are between 90 and 100, then 4 of them are below 90%. As you see on the graph, almost all the indicators are above the 100% line. As finally a remark, Leah wants to prepare standard documents on HPPC development and share the well-articulated experiences with other similar organizations. Thank you very much.
Thank you so much. We're really having tech problems today. This one working? They must be tired or something. We're going to try to bring Marlene back on. Thank you so much. That was awesome. Can we try to bring Marlene up to be able to do the last few minutes sharing the Ethiopia experience, please? Sorry, Haiti experience. Is everybody awake? Well, already we've heard a couple of different things. There's Marlene. We're hearing about difficult implementation in a difficult environment. We're hearing about implementation from a transition in a very short period of time. These are all questions that I think many of you are facing as well, and so it'll be interesting to also hear your thoughts and your experiences. Over to you, Marlene, to share your story.
Internet situation, okay? All right. Okay, my name is Marlene, and the title of my presentation is Local Solutions in a Global. It is a case study of CFET, a for-profit company. It illustrates the step-by-step capacity development processes, preparing CFET to become a prime implementer or a local partner implementer. Amy, are you going to be showing the slide, or can I just
continue, Marlene? We're getting the slides up.
Okay. So CFET stands for, in English, the Center for Training and Technical Assistance. It was created in October 1st, 1988. And CFET empowers and develops local skills necessary for communities to take charge of their development options. And we envision a Haiti where communities are in charge of their own development. We work for governmental agencies, bilateral and multinational agencies. We work also for the private sector. We provide services to projects and organizations in human resource management and capacity development. We've had a long history working with USAID as subcontractors. We've worked alongside Management System International. We've worked with Tetra Tech. We've worked alongside GAI, the Development Alternative Inc., in the Water and Sanitation Project. We've worked also with RTI and with Management Science for Health. We are MSH implementing the Health Leadership Project. And MSH in that project was the prime responsible for CFED preparedness to lead the Haitian Leadership Project Human Resource for Health. Can I see the next slide, please? Okay. Now, how did we set the stage? First of all, the Health Leadership Project had two objectives. The first one was to build government Haiti capacity to lead and finance the health sector, and also to improve the government's planning and oversight of the health workforce. MSH was the prime, and CFET was a subcontractor being prepared to implement Objective 2, and there is Group Croissance, another local partner, was being prepared as well to lead Objective 1. So setting the stage legally, CFET, we were fine because we were registered with the Ministry of Commerce. We paid our taxes regularly, and we had a board of directors. So those three basic requirements are requirements to do business with both the Haitian government and USAID. And other factors that we took into consideration at the organizational level. First of all,
Marlene, are you there? Oh, okay. I think what we're going to do, because we're getting a bit late and also we want to have some time for a discussion, is if you could contact Marlene, and we'll take her offline right now, if we can bring her back on, but we'll just jump into discussion, and through the discussion she can share some of the points. Sound good? All right, Marlene, if you can hear us, we're going to be asking questions. Just talk to Ellen and we'll get you online. I know it's hard right now, and we really, really appreciate that you're coming to us virtually from Haiti. Oh, this is gone. No, you're fine. You're fine. You're good. Okay, as promised, the first question that we're going to ask is, the first question is about the challenges in Uganda. Oh, can you hear me? Table. This one doesn't work. Oh my goodness. Wow. What day is it today? This is it really goes to show you just have to be ready for everything. Every single angle, everything that works or doesn't work. Luckily, I did print out the program and the questions, so we're going to jump right in. Sarah, you talked about your transition, and you carried it out in a really short time frame. I can imagine there are many, many challenges. Can you describe briefly the major challenges you faced and how you were able to mitigate them?
Thank you very much, Amy. The challenge is in the question, actually. That short time transition is a challenge, and how we mitigated it. I have already talked about issuance of letters of authorization to spend as the pre-award assessments were ongoing, and preparation of the sub-award agreements. So that helped the partners because it is actually detailed. It shows you what to spend on so that you don't diverge from the objectives. So that was done and it worked well. Then there was strategic recruitment. The proposal writers are actually the ones who were implementing the activity, and they understood the concept. Then another type of strategic recruitment, we had to look for the staff who were formerly in rights, including Akatkunda. Yeah, so they knew already what to do, so they were ready to run with the project. Then there was already existing relationship with the member health facilities, and which helped us to the aided entry to the facilities. There were some changes in the management structures to respond to the growing organizational needs. So briefly, that was the major challenge. Other challenges were, of course, now the transition happened during the time of COVID period. So sorry that most of the health workers were dying, but we thank those who were resilient. When I say it, I grow goose pimples. It was a real challenge. We had to adopt online, which we were not used, online system of working, which we were not used to, but all things worked. So it was successful. Then the LSDA design, where we mostly facilitate the health workers. We have few activities, and salary payment, HRH management is not that easy. So that was also another challenge. Then the last challenge I can talk about is a risk of having 80% of the funding going to sub-grantees. It's a real risk. You need strong monitoring systems. You need to be alert all the time and ensure that no money is abused. You prevent fraud, abuse, and misuse of resources. So that's a challenge because we have very many sub-grants. Like you have seen 34 sub-granted facilities. We have 25 CSOs. We have those who are directly supported. So it's really hard work, but we are managing. Thank you. Sorry?
It helps to avoid fraud. What kind of things are you doing to avoid?
Oh, yeah. The kind of things we are doing to avoid fraud. Yes, we have an internal audit function, which is fully fledged, and they are in the field actually most of the time, like 80% of their time are in the field, looking at what the facilities are doing, whether they are compliant. Then we also, as grants team, perform 100% voucher review to subject all the payments to the cost principles to see if they are allocable, allowable, if they are reasonable. So we do kind of a lot of work. We have a monitoring plan in place, which we implement to ensure that at least we are able to follow up the sub-recipients. There are a lot of things that we do, but those are just a few. Thank you.
We have another follow-up question and no more working mics. So could you just stand up and share your question?
Thank you very much. Would we say the success here has been in addition from your effort and also as a result of capacity building by the 3 international organizations who handed over to this local president? Would we say they made a contribution to the success you are seeing through the multiple or tens of sub-recipients you are working with?
Yes, I can say yes, because at the time of the transition, Uganda Protestant Medical Bureau was a sub-recipient to Rights E, which was implemented by IntraHealth. So at least they did not start from zero. They had their capacity built, and I know that that one also contributed to the success. Thank you.
I'm going to just jump in, thank you, and ask one question, and then we'll take another one from the audience. Aklilu, in the last 2 years of your transition, because it's been a quick and tight one, even though you've been around for a long time, can you share the major implementation approaches that you took that could potentially inform other organizations?
Yeah, thank you. As I mentioned, the first thing or the very important thing was the promotion of the idea itself. Mindset matters for any success. We try to promote mainstream the idea of HPPCs among our staffs and other representatives like board during the recruitment processes, during trainings, review meetings, and the different platforms that we have. That is the first thing we have done. That's the norm, and the behavior issue is very crucial and very important to bring any kind of change. Change is not easy, it's very difficult, but it starts on mind. That's what we believe in our organization. The second one is we have approach touched to the key stakeholders. When we started the project in Gambela region, the hardest to reach region, the stakeholders were not systematically organized. There was even conflicts. Some were used, overused. Some of them are overlooked, like women groups, youth groups were highly overlooked, and there was a kind of disputes and simple conflicts. So what we did was we conduct an assessment and we designed an organogram which can accommodate all the stakeholders in one command. Then we discuss with the government and get approval, then finally start to implement that organogram. We call it key stakeholders management organogram. And it is led by the regional technical working groups, and it has the service delivery and the quality management lines, and at the grassroots we have different task forces. So we arranged the stakeholders based on their existing responsibilities without overlooking and overlapping of their roles, and that's how we did on arranging the key stakeholders, just in the way they can play meaningful roles in the project management as well as in the decision of the project process. The other thing is we incorporate the simple micro planning tools. This is a simple concept. It is just preparing breakdown of plans by SNUs, by volunteers, and by community facilitators and community engagement facilitators. That is how we design the micro planning processes. And the other thing, we have a breakdown of services. The SOP is, as you know, it is very big. It's difficult to understand for those people who are working on the grassroots. We just try to prepare a kind of job aids using a local language. That's one of the things that we have done. The steps are clear. The steps become very simple in the way they can understand easily, and in the way they can implement easily. And we have also service maps, which we have been preparing using local materials and local languages. And there are such kind of packages included in the micro planning processes. The other thing is the final one. We implement real-time feedback management. We call it RFM. It is an online system where all staffs are expected to report on daily basis. They report their performances, their security challenge, any pictures, any progresses, any updates of their areas. Every time they post it, their supervisors see and respond to it. Even sometimes organizations have, in general, the managements have a chance to look at and to give flexible decisions on some of the key challenges of the staffs at the grassroots. I think these are the major implementation approach that we have been using on our HPPC approach.
Thank you so much, Aklilu. We have some questions in the audience. We also have Marlene on the line. And I think what we'd like to do is about 5 minutes, we're going to give Marlene the last word. That okay for everybody? Okay. Let me run around and give mics. Oh, okay.
Yeah. So great presentations. I just wanted you guys to share more on the specific actions from the USAID missions that helped with the transition, the smooth transition.
Sorry.
Oh, now it's on. No, it's been.
Okay. There are so many things that the USAID mission helped us, because definitely we wouldn't issue letters of authorization without clearance from USAID. They helped us, they guided us in helping us to ensure that the assessments go on. Of course, they had also performed the NUPAS on us, and we were supposed to do the same to the subrecipients. They also advised us to adopt a better accounting system, that is Navision, from what we had. And they as well helped us to update our policies to ensure that they fit within the funding that has been received, because the former ones were not working well. They wouldn't help, they wouldn't work with this kind of increased resources. So those are a few things, but they did a lot. Thank you so much.
Yeah, we're having some shorts or something.
Yeah, USAID has been supporting us generally in capacity building of our organizations and project management capacities. Beside that, that's very general. Beside that, the increased funding by itself has a real impact on organization development. That's very important, which we always consider and which we are very much thankful, because it increased or it boosts our capacity to manage our programs properly, and including our coordination, partnership, even it increased our visibility in the area. We have been working in Gambela region in like two districts. Because of this support, we expanded into 8 big districts. So that's a big impact. That's a big contribution. There are also some ethnic-based politics in each of the regions. Even it helps us to address those kind of issues, in especially in the community side. So the support from USAID is very visible and very countable and very strong. And thank you for that. Yeah.
Now I finally do that. There we go. Finally. Do we have some other questions? Yes, ma'am.
Yes, thank you for your presentation. International NGOs have played a critical role in some transition, coaching, mentoring, both technical OD, a transfer of staff formally with international NGOs, and in some cases, adoption of international NGOs policies and procedures. At times, wholesale. What is your opinion in terms of, do you think that is what is the future of a North-South collaboration in terms of information exchange? Do we still need international NGO? For example, in your presentation, you ended by we need more money in local NGOs so that we can strengthen health systems. And I'm wondering what data are we using to make that determination that when money is in local NGOs, our health systems will be stronger. Thank you.
Okay, Chris.
Thank you so much. I wouldn't want to decampaign international NGOs. Definitely, they have super policies, they have systems in place, they are so strong. So actually, they are supportive to the local NGOs. they are so we may not now do without them, because they can even perform oversight roles and ensure that we are on the right track. So we still need them. Thank you.
Yeah, they are valuable, and we want to work with them. The how part may be different from time to time. How we can collaborate and how we can work together. That is something we all sort out, including the USAID team. It needs some kind of standardization and setting scopes and defining roles of local partners and the international partners clearly. That's very important. Otherwise, they are very important. They are helpful. We still want to work with them. As I mentioned, the GISS program it's a collaboration supervisory team organized from the international partner, the community partners, the beneficiaries, and Love in Action Ethiopia. In that platform, all the people in the platform get chance to deeply look at the data, services, and the life change on the grassroots. So that process was completely led by the international partners. Finally, the report will be submitted to the USAID, and we got feedbacks from USAID local mission. So the process is very healthy and very helpful and very complementary. So it is very important to work with international partners, but the how parts we can discuss further as we grow up. Yeah. Yeah.
I think it's a great topic. We could have probably done a whole session just on that. So let's take that down. We're almost at time. I'd like to take at least one more question from the audience. And
Hi.
Ellen is yelling at me. I think it's about Marlene, that she's ready to come on. And after this question, we're bringing Marlene on. She's going to do a summary of her presentation. And she's also going to respond to some of the questions that have come up during this session. Ma'am, over to you.
Hi, Emmy.
Who is it?
Greetings, Yvonne.
Hi.
Really nice to see you. Anyway, to be quick, hats off to both of you. Well done. And again, just back to you and just to Uganda USAID with their risk appetite. Oh my goodness. I have a similar story to share. Transition from an international NGO to a local NGO, and we immediately got an award. Had 5 sub partners, thought there were many, but compared to what you had, so I'm thinking, did you get any leadership ownership from the church mother body that could have maybe given USAID some confidence that you do this for the first time as an INGO with all those sub-partners? What did the mother body invest, or what commitment did the church put into this grant or program?
Thank you so much. The church, the member health facilities were supportive. They were with us right from the word go. And like I have said, when we won the award, they were ready to help us with facility entry. We wouldn't enter all those facilities at the same time, so we collaborated with them to help us deliver the information about the project to their facilities. So they owned the project. Thank you.
Thank you for that great question. Is everybody with us still? I know that there were side discussions wanting to talk a bit more about income generation and how local partners can sustain themselves, if that's possible. I'm really happy we have our CFO in the room. Just to mention that some of the local partners are, struggling with some of these issues. And I think it's an important topic. I'd love to talk more with folks about that. And I think we can actually think about this for next year, because as you guys are getting your resources, you're transitioning to local partner, you're taking on more and more, but how do you sustain yourself? Are we just sustaining you through the money to sustain? And then what does it mean for the long term? With that, I want to transition back. I see nobody's asleep yet. Thank you. To Marlene. And Marlene, thank you so much for staying on the line or trying to get back on. It would be great if you could, I know you're about halfway through your presentation, if you could kind of wrap that up. And it'd also be wonderful to hear your responses to some of the questions that have been raised around support from the kind of mother office, around do we need international NGOs, and around sustainability. So you've got a very attentive audience with about 50 or 60 people in the room, Marlene. Over to you right now, and you have 5 minutes. Thanks.
Okay, thank you, Amy, and I'm very sorry for the technology problem. Well, what I think, I would summarize basically how did we succeed. I think from CFET point of view, with the fact that we obtained our board of directors buy-in, and they supported us all the way. So I think that was a key element in our success, that the board supported the project. And secondly, the fact that we assigned a client relationship manager to manage the project as a client portfolio, and making CFET a client, whereby we were following up closely of how we were doing. And of course, the capacity building processes that MSH put in place. The fact that we were, after the initial assessment, we were regularly assessed every 6 months to measure our progress. So I think that also led to our success. And the fact that they focused on all the weakest areas of the company, especially in the project and financial management. There were certain tools that we did not have, and that came very handy. At the governance level, there were certain tools that we did not have. For example, you have the succession planning. We did not have a succession plan together. And thanks to that, since we had to reorganize our organizational chart, so the succession plan helped us really reorganize our staffing. And then, of course, the contingency plan that they help us put together, and that is helping us right now with the situation that we are going through. So how can we, despite everything else, keep on working and deliver services? So these, I think, are very important tools that MSH helped us develop at the organizational level. And right now in the transition, MSH is still there, working with us as a coach, as a mentor. Whenever we have questions, we have doubts, we can call upon them, because given the fact that they are well experienced with the Ministry of Health, so they are there to assist us whenever there is a need. And again, for the question regarding whether or not we need international NGOs, I think we still need them. I think there is enough space for both local entities to take ownership of, as I said, of their development, but at the same time, there is room for international entities to assist local entities to really take charge of or take ownership of their development. So, so I think that it is a very well thought strategy, working together with local entities to transition into a leadership and ownership.
Marlene, thank you so much for that. And I believe, Ellen, are we at time? But before we, sorry? I'm going to hand it over to you for the last word in just 1 second. Before you leave, George, I see you in the back of the room. Are you there? I wanted to, we were talking just before, I'd love to hear for you to share some perspectives around the sustainability that you all are thinking about. I wonder if you could just take 1 minute to speak to the challenge and proposed solution.
Thank you, Amy, and the presenter. Congratulations for making up to have a strong NGO now standing and providing service in your country. Actually, we also transitioned. George Anatoli from Tanzania Health Promotion Support. We transitioned from into area in 2011. Actually, just to a brief story of where we came from. You know, when PEPFAR 1, Track 1 started in 2005, the implementers of Track 1 funding were American University, Columbia University in Tanzania, Harvard University, CLIS, and EGPAF. Then after 5 years, there was a class deviation waiver which was granted by the US government. They allowed those institutions to continue for 3 years, then at the same time transition the operation to the local NGO. Then we took that opportunity to transition. From there, we have been working. We have 6 mechanisms, 2 from USAID as a prime, 3 from CDC as a prime, and a global fund. Also, we have been funded by UNAID, UNAID and CIF. So when we are talking of sustainability, actually, we have transitioned, but the big challenge, I see the big challenge of be sustainable. And for the non-profit organization to be sustainable, actually, we are talking of diversification of funding mechanism. For example, you see they are doing a great job, but when USAID pull out, you close the office. So you need to focus on, having different mechanisms of funding. Also, you need to think of starting working with the private sector within the respective country. Also, you need to think of, actually, that's a far-fetched, which we are thinking, how we can transition this program to the social enterprise. There are services that people can pay, but the big challenge that we are currently, and everybody is facing those, is related to the flexible funding. You see, we are funded, we have money to run a program, but if you don't have flexible funding, there are things which you will be missing. So we need to focus on how we can make this local entity having a sustainable, flexible funding. And actually, when we are talking of flexible funding, we means there are things which we can do, like, of course, when the donor go away, you don't have office, we close the office. But if you have flexible funding, at least you have office. If you need the office, you can keep in that office while responding to other proposals. So we need to start thinking of such approaches to ensure at the end of the day, these entities are sustainable. Actually, sustainability also should be discussed along with the transition. Thank you.
PMB and Action have thought about this stuff and have sustainability plans as well and are thinking about it. And it was great to hear your perspective as well. We are at time though, folks, and I know it's late and people are tired. So can I give Callie the last word and then we'll thank our panelists.
Amy. Yeah, last announcement. There's a beautiful woman in the back of the room. Ellen, wave your hand. She's doing a video project. And what we would really like is to hear from you on video. Please tell USAID things you want to change. Tell us successes you had. Ellen will be in office hours today in the next room. So you can find her at office hours or tomorrow. Find her and she will record you. Okay, that's my announcement.
Let's give the panelists and Marlene a big hand. Thank you guys for bearing with us. Thank you so much. Yeah. I'm walking away. Yes, let me.